So welcome to the info session of the NAM International Health Policy Fellowship. It's now called Cheng-Dzau NAM-CUHK International Health Policy Fellowship. So I'm Professor Roger Chung. I'm the co-director of the Center for Bioethics at CUHK, and CUHK is the stewardship of this program. So that's why we're holding this information session. So welcome everybody, and I'm going to share with you first an overview of this program. You can type in your questions anytime at the Q&A section of the Zoom. If there are any questions that you would need them to be answered, our staff is going to be here to help you with that, or we're going to address them after the presentation. So I will give an overview first, and then it will be followed up by Professor Kim Chow, who's the third NAM Fellow. She's actually the third cohort of this fellowship, and I was actually the first one. And she will tell you more about her very recent experience. So my experience came from some 5 to 6 years ago. But Kim's experience is very, very recent, so it will be very relevant. Okay, so I'm going to give you an overview now of the fellowship program. So NAM, a lot of people would be asking, what is really the NAM? The NAM previously was called the Institute of Medicine. So a lot of people probably know about IOM. So about 6 years ago or 7 years ago, it was renamed as the National Academy of Medicine. So now everybody just call them NAM. It is a very leading, prestigious, independent advisory group on health policy in the US and really around the world. It's not just the US. So it really depends on who's really asking the policy question, right? And the institution or organization or the group asking those questions would then commission the NAM to conduct these, what we call consensus studies. So NAM is one of the 3 national academies in the US, along with sciences and also engineering, established statutorily under 1863 Congressional Charter. So it actually went all the way back to the days of Abraham Lincoln. But it works outside of the purview of the US government to provide independent, objective, and evidence-based advice on matters on health and medicine, specifically on policies and actions related to health and medicine. So as I said, the NAM consensus study is really their flagship methodology to kind of, gather people, experts, in a panel to really discuss these policy directions and make recommendations. So they are then required to come to some kind of consensus. Okay, so if these are the evidence, scientific evidence, empirical evidence, experimental evidence, clinical evidence, etc., and opinions from different people, policymakers, people who are working in, for example, medical ethics and etc., then, how do we move forward in terms of policy? So this is really talking about bridging scientific evidence and data to real life action. NAM is also a membership organization. So it is actually considered to be one of the highest honors in the field. And we have over 2,400 eminent professionals from diverse fields who, when chosen to be an NAM member, then they would volunteer their expertise in these consensus studies or other workshops that NAM organize. So this is an important information for you, because if you're chosen to be an NAM fellow, you will then need to work with an NAM member, selected member, who will become your supervisor for your fellowship. So Kim will tell you more about that later. And talk about the consensus studies. These are some of the very famous consensus studies, starting with the IOM To is Human report that probably a lot of people have heard of or have actually read, right? First, do no harm. This is related to the principles of non-maleficence, but the idea that we need to have quality and safety in our healthcare, and to err as humans. So how do we move forward to make a safer health system? And the sequel to that is crossing the quality chasm. And then, if you're in the field of nursing, then you also know about um, uh, the future of nursing reports, and also the consensus studies that follow that report in the past. Now, let me ask, are we recording this session? It would be great if we are recording this. I would like to know. Can anybody tell me? Are we recording this?
Yes.
Okay, we're okay, good.
From the chat box.
Good, okay. Yes, so this can be shared afterwards with other people who are interested in applying. And also this is again, the Quality Chasm series called Improving Diagnosis in Healthcare. This is just released recently. Okay, so these are some really landmark reports out there. And this Health Policy Fellowship was established in 2017, as you can see over here in this picture. So this is a flagship cornerstone partnership between NAM and CUHK Medicine. Okay, so we have actually signed an MOU recently to solidify this partnership. This program that we call NAM CUHK International Health Policy Fellowship. Sorry, there's a typo over here. Health Policy Fellowship Program. It's a 2-year fellowship and it's stewarded by our Center for Bioethics, and it's designed to equip emerging CUHK scholars. Usually we're talking about early to mid-career CUHK scholars with the expertise, networks, and vision needed to advance international health policy. Okay, it's a biannual program, meaning every 2 years we're going to select a fellow. And by now, we already have 3 cohorts, and the upcoming application deadline is going to be in January 2026, 16th. Right, so the 3 fellows, including me, myself, that's the first one, and then we have Vincent Chung, and also Professor Kim Chow, who's going to be presenting also today. Here's the eligibility criteria. I know that a lot of people have been asking about that. So each candidate must be fluent in speaking, reading, and written English. That's a no-brainer. A full-time CHK faculty staff in his or her early to mid-career. So we're really talking about 2 to 10 years of postgraduate work experience who hold a doctoral degree, okay? Of course, this is health policy fellowship. So we're thinking about people with a degree that is kind of related, okay, to health and medicine, but they don't have to be, okay? So you can have a JD or you can have a PhD in economics or policy, political science or social sciences, and you will still be eligible. But the key is you are a early to mid-career faculty member of CUHK, right? Other graduate degrees may also be considered. So we're trying to cast the net a little bit wider than just people with a health degree or a medicine degree. And they need to demonstrate commitment to improving healthcare, and also health policy. They also need to submit required application documents. Okay, the application form is already available on the website. If you're going to scan the QR code, I'll show you the QR code later again. It will bring you to the website of CUHK Center for Bioethics. Even if you don't scan the QR code, you can just go to CUHK Center for Bioethics website and then go to our fellowship prompts. Okay, and then underneath you will see the Cheng-Dzau International Health Policy Fellowship Program. You need 2 letters of reference and a supporting letter from your department chair or faculty dean or school chair, okay? So you need 3 letters in total, okay? For the program, okay, it is, again, a 2-year fellowship, 1 fellow selected biannually. and you need to spend 25% of your time in Washington, D.C. with a very initial intensive 3-month period when you start your fellowship to really get you on board so that you actually know what is going on and how you're going to contribute. Okay, you will know your role during those 3 months, and you will actually need to be attached to a study. Usually it will be a consensus study, a project, okay? And you will maintain your current CUHK appointment and salary during the fellowship. So again, this is very important because you will need the support from your school or your department and your faculty to pursue this. And you will then need to pursue this with an individualized project, and Professor Kim Chow will talk to you more about this later because it will culminate into a final report and also a presentation to NAM and the CUHK community, which Professor Chow has already done hers several months ago. It was 2 months ago, right? During a typhoon, actually.
A typhoon.
Yes. The Endow Grant from the Lanson Foundation. So this program is actually supported by the Lanson Foundation. So that's why when you see the name there, Chang, it is actually Dr. Eka Chang of the Lanson Foundation. It is an endowed grant, and that grant will be provided to support all the program fees incurred at the NAM for the selected fellows. You probably will be asking, so what about the other fees like traveling fee or accommodation? So we will actually encourage you to figure out and to try to find out whether there will be other supports for you for the accommodation and also for the travel. So you should explore that first before coming over to us. So we will be able to help, but it will be on a more of a discretionary manner. When we talk about the financial support for this program, so you're encouraged to explore, support for this first. So for me, I'll go through this very quickly. I was trained as a social epidemiologist, and I study health inequalities, focusing on poverty, deprivation, and socioeconomic disadvantage, environment, housing, and migrant status, particularly on vulnerable populations also, and also a little bit on aging issues, end-of-life care, long-term care, and all that. So when I first started, the first thing that I have to figure out is, okay, so which is the project that I should attach myself to, right? So as a first inaugural fellow, I didn't really know much about it because, there's no predecessors. So the first 3 months for me was very intensive in Washington, D.C. And there was only the first 3 months for me anyway, because then in 2020, COVID came, right? So I first went there in 2019 during summer. Before summer, it was April to July I was there. And I was trying to figure out, okay, so which is the project I would be attaching myself to? So this is something that you will probably need to do. And I think it will be even greater if you can do a little bit of research for your application, right? When you submit your application, to see, whether there are any projects or consensus studies out there that you would like to further pursue, right? So the key experiences for me and opportunities for me for this NAM fellowship is very invaluable because then you will be engaged very deeply with international health policy through this fellowship. And really what you will be able to witness is how they actually come to a lot of these consensus and recommendations for policies. Okay, so if you're attached to projects, of course, it depends on who's asking the question again. The policy question can be asked by, for example, National Institute for Health or the Health and Human Services in the United States government, okay, or other foundations or organizations or NGOs, even if they commission the NAM to do it. Then you'll be able to witness how they kind of form the groups, the core groups, or they call it the NAM study committee, right? There will be handpicking experts in different fields without conflict of interest to work on the project or the consensus study. Then they will be convening these meetings, okay, with other experts. They may invite people to give presentations, and they will listen to those presentations. And you will also need to go to these presentations to listen to people talk about, their studies, their insight. And then they will convene these closed door meetings among the study committees to talk about, okay, so these are the evidence. How do we move forward? Okay, what kind of policies should we recommend based on these state-of-the-art data and evidence? Right, so that is actually very eye-opening for me, and I'm sure Kim will also attest to that. And for me, I had the opportunity to contribute to an article to the NAM Perspectives, which is very well read. And I did it with Sir Michael Marmot. So my relationship with Sir Michael Marmot, who's very big in health equity research, really started there during the NAM fellowship period. So he was an international NAM member, selected member. So he was working with me on this article, and then, the relationship really started from there, and I'm still working with him on a lot of these health equity research to this day. And then I also contributed as, they would call you the consultant as an NAM fellow on an NAM consensus study on pandemic vaccine preparedness and vaccine equity, right? Specifically, I was working on this because they know that I really like health equity. So they put me there, and then I saw, these global health conversations at work, right? And that is extremely, extremely good experience for me, right? So that's why after this fellowship, I was then invited by our school to really lead the population and global health program at the School of Public Health and Primary Care, and also the MPH Master of Public Health program, specifically on global health. And then, I also serve on the organizing committee on an NAM workshop on healthy longevity. So I actually get to bring in advices and tell people, okay, who are the people we should definitely invite? I was doing all these research, getting to know these people, and then, then we're contacting these people to kind of form that group, right? So that was another very great experience, right? So a little bit beyond just the kind of day-to-day research that we're doing, it's kind of like, okay, so how do we make this into impact? It is all about impact. Yeah, so, and then I think Dr. Chow will talk to you more about this. How do you contextualize these global findings for local relevance for her, specifically for her project? And yes, I think it reinforced my strengths and my, in my research area. And really, I think it also, because of my engagement in these research, it also helped to advance CUHK engagement in these research. So this is the article that I co-wrote with Sir Michael Marmot, and it was actually one of the top 10, it was number 6, I think, that year, most well-read articles of the NAM Perspectives. But, you see that I was talking about Hong Kong, but then, when you bring it over there and you bring it into a more international perspective, then people will be really wondering, why is Hong Kong having the longest life expectancy in the world, right? So what have we been doing right that other people around the world can actually learn about? And that is the consensus study that I worked on. It's countering pandemic threat through global coordination on vaccines. And also the workshop that I contributed, the global roadmap for healthy longevity. This is part of the colleagues, my colleagues at NAM. I've been working closely with these people on these projects, but we also have fun time. This is baseball game. I wasn't very into baseball, but it's good to hang out with your folks. We also get these very unique opportunity. This is actually the Rockefeller family inviting us to their mansion, just talking about how do we move things forward, generally speaking, in international health. So this is me, and standing right in front of me is Dr. Echo Chang, who is a big part of this Cheng-Dzau International Health Policy Fellowship. And then, these things can bring forward to the present time. This is actually just last year when NAM came over. Victor Zhao is right in front of me. He is the director of NAM. And this is actually a meeting that we're actually doing at Hong Kong U. And the Hong Kong U Fellow, so Hong Kong U also have the NAM HKU Fellow, and then we have the NAM CUHK Fellow. So we're all meeting together. So we actually have these regular meetings with each other. And, I also built some, good friendship and partnership with the Hong Kong U NAM Fellow also. Yeah, so this is Victor Zhao when he was at CUHK being conferred an honorary doctoral degree. I was there to congratulate him. So I'd just like to acknowledge all these units and people: Lansing Foundation, CUHK, CU Medicine, School of Public Health and Primary Care. That's my school. So that's very important that you get your support from your school and your school director, right? Institute for Health Equity, NAM, the fellowship supervisor, my project teams and committees, collaborators and mentors, and my family. So again, this is what you need. Okay, scan the QR code over here, and they will bring you over to the websites. Okay, and thank you very much. And now I would like to give my time to Professor Kim Chow, who is an associate professor in the School of Life Sciences of CUHK, and her research is really on brain metabolic changes in Alzheimer's disease, and also related to dementia, and also other diseases related to the brain. And she will tell you about her experience, very recent experience as an NAM fellowship. And I think you will learn a lot from that. All right, here you go. Thanks.
Okay.
Thank you, Kim.
Okay. So thank you, Roger. Can you see my screen now? Yes,
Yeah.
right?
Yes.
Okay, fantastic. So I believe that you have heard a lot about what is this fellowship is about from Roger. And at this moment, I would like to share my very recent experience in this fellowship as the third fellow. So I guess the first question you need to ask about yourself is, why do you want to be a health policy fellow? And this is not an everyday question. And if you're particularly interested in this fellowship, you need to ask this right ahead of starting the application. So here I would like to use my own story to share about why I want to do that, and of course my journey through this experience. So if you know me, you know I am a trained bench neuroscientist working on Alzheimer's disease. And so my daily life experience is all about working in a lab, working on animals, working with a microscope. So you can imagine that my eyes are always somewhere not quite stick to the reality. I really have a very microscopic view of the world. And my research focus, to be more exact, is on understanding how lifestyle risk factors are related to brain aging and dementia over time. I intended to address the cellular molecular mechanisms on how various complicated lifestyle risk factors contribute to that. So, but indeed, you can see that I want to highlight is that my professional journey actually goes beyond the lab. I do have a track record or unconventional passion on health policy and research advocacy, even at the time well before I joined CHK. So this kind of showcase or at least demonstrate that, well, even as someone who very unlikely to be related to public health or health policy, I do have some experience to share and demonstrate why I care about that. And in this space, I do have a mission in my mind that's to help shaping public health recommendation that encourage behavioral lifestyle changes at population level, even though I'm a bench scientist. And because I'm working on a chronic disease, and I know that prevention is the key instead of finding a drug that deal with the consequence afterwards. So therefore, I always take every opportunity to do this. So here are some of my pictures showing that that was in the U.S. Capitol in one of the state senator's office. We were actually as a group of young scientists, we were advocating for increased research funding for basic neuroscience research in the upcoming fiscal year to support research. On the other hand, on the far right, actually is a picture of Professor Hellerman from the engineering faculty of CHK. So that was a time well before I joined CHK. Again, it was 2018. So that was when I was a fellow at the World Economic Forum, which is also an international advocacy non-government organization, or you can call it a think tank that foster public-private cooperation at policy level. So during that fellowship, so Helen was an AI person, so she was in a council related to AI while I was already working on something related to new technologies and how to adopt the technologies ethically. So in that fellowship, I also had some deliverables working in a group that draft this to be involved in drafting this white paper published in NAM Perspectives. So with this experience, I guess this is persuasive enough to the selection committee, and then I was elected as a third fellow of this fellowship. And in this fellowship, so I'll tell you a little bit more later about details about the journey, but it was an incredible opportunity, I guarantee, just like what Roger has mentioned. And very fortunately, the fellowship allowed me to work on a topic which were perfectly aligns with my research interests, while also elevating my knowledge and expertise to a new height. During the past 2 years, I would say that I had the privilege to contribute to a consensus study as a consultant that outlined the research priorities for addressing Alzheimer's disease and related dementia. And this study actually identified key scientific questions that used to guide the national issues of health funding decisions in the upcoming 3 to 5 years. And additionally, the fellowship also allowed me to work to advocate for greater focus on Alzheimer's disease and related dementia prevention, particularly focusing on the criteria or critical, I would say, yet very often overlooked period of time before midlife. So when we talk about these kind of disease, we always talk about elderly people, but indeed, prevention could be done well before that, and even at the time of pre-birth through adolescence. So this was a kind of thinking that I've never thought about before I joined the fellowship, and it just came up by exposing to opinions from different experts, and including my mentor. And as Roger mentioned, he is a NAM elected member. He works on nothing related to Alzheimer's related dementia, but he is actually working on neurodevelopment. So with his knowledge and perspective, we came up with an idea, or quote unquote the project, that is to maybe to rethink Alzheimer's disease and dementia as some sort of neurodevelopmental disease with delayed onset. So that is a very, I would say, a very provocative idea in the field, but there are indeed a lot of evidence already emerging from various studies, and we're working on the paper, which is also one of the deliverables of this fellowship. So here, so that was an overview about my journey. So here are some important items that I would like you to think before you put in your application. First of all, again, that the same question, what does health policy mean to your work? That's your vision. Secondly, it's more practical question. Would you be able to commit and stay in Washington, D.C. for 3 months per year in your upcoming 2 years? This is very important because for myself, I belong to Faculty of Science, and there's a lot of teaching. So how can you arrange your teaching? And from personal family, so do you need to take care of your children and other things? And of course, the students in your laboratory. So how are you going to communicate with them and maybe monitor their progress when you're away from Hong Kong? On the other hand, another question is, are you up for the challenge that you may end up with projects that could potentially deviate slightly or maybe largely from your own lines of work? This could be occurring because, well, as I mentioned, I was fortunate enough to land a study that relates to myself, but it was not completely 100% in alignment with what I've been working. So I'm a bench scientist, but most of the work that I've been engaging in that consensus studies were very much public health related. So are you up to the challenge to learn new things? For me, there was a steep learning curve at the very beginning. I have to learn from well, what is public health and what how people are thinking about the disease from that perspective. And of course, to overcome this steep learning curve, you need to pay extra effort and time. And during those 3 month period, very intensively, to be honest, I almost let go of my own personal work in Hong Kong, but to be very engaged in learning about these new ideas and working on the paper, the consensus study, and the working report with my colleagues and supervisor in the fellowship. So if you have all these thoughts clear and then you put in an application, and then of course you will be going through a selection process, which involves an interview section with a panel of experts. So they will ask you questions why you exactly in the same way that I laid it out. Then afterwards, if you were selected, then first of all, congratulations. But once you learn this outcome, it means that your 2-year clock starts to click. So my advice to you would be, if you're selected, first of all, don't be thrilled, but try to be a little more strategic. So be proactive in reaching out to the NAM fellowship staff. It is you to take initiatives to contact with them, to initiate the conversations. I think this is very important. And also, as Roger has mentioned, also try and learn the latest updates, ongoing and upcoming studies at NAM, because this will probably be some of the projects that you will be engaging in. And again, you are actually hooking up with the studies that are ongoing in NAM. And again, I want to emphasize that it might or may not be falling in line with what you're expecting or what you've been doing to do in your own laboratory or in your team in CHK. And start planning your trips to the States. So if you need traveling visas, I encourage you to potentially get a supporting letter from them. They're very supportive in that. So get the traveling visas ready if you need that. If you already have one, that's okay. So I travel to Washington, D.C. with my B1, B2 visas. There's no troubles at the border. So if I could do that, I believe you could do as well. So if you need that, if you don't have a visa in handy, so you need to apply for that. And personalize your residency schedule is also very important. I believe everybody would be busy in different times of the year. And it could be at any time of the year, to be honest, to do your residency. So try and communicate with the fellowship staffs and have them to arrange with you, well, your arrival, well, how the accommodation and other things. So if you're to be elected in the next fellow, I would like to encourage you to attend. There are 2 fellows forums to be organized by the NAM, one to be held in September and October, and the other one in April. And during that time, it would be good for you to reach out to people in person, including your potential mentor. So actually, I found my mentor in one of these meetings. And of course, to meet up with the potential consensus study group leaders and staffs, because there could be potentially interviews between you and them. So even though you are elected, well, you're elected as a health policy fellow, it doesn't mean that you could be automatically be engaged into any consensus study that you would like. So they do have their concerns. They would like to see your CV and interview you further on how you could contribute to their consensus study. So so you need to find these people at best to meet them in person so that they would be able to know you more and think whether or not you are suitable to join their study as well. So here, this is my fellowship deliverables. You can probably have an impression that is pretty different from Roger's. So I have this laboratory experience that I've gained it from working in the lab at CHK. As a fellow, I just like Roger did, but he works on 2 consensus study, but I just work on 1. So I had a consensus study working on a topic related to Alzheimer's disease and dementia, and that in that consensus study, I contributed as a volunteer consultant to that. So just a little glimpse about that study. Well, majority of the panel experts in there were in the field of public health, and I joined them as a bench scientist. And actually, I contributed a lot to one of the chapters in the consensus study report, highlighting how I bench science could bridge to public health science. So that was something that I intended to do, I'm glad that I could contribute to that. On the other hand, I also work closely with my mentor of the fellowship, Professor Ted Abel. And as I mentioned, he is a neurodevelopmental biologist while I'm working on the other side of the spectrum. And we're working on conceptualizing Alzheimer's disease and related dementia as a developmentally rooted disorders for novel strategies in dementia prevention. And we are working on a paper that's the working paper mentioned in the application, and it could be in a report, it form a review or perspectives, and it's now under revision and e-biomedicine. So the last part of this fellowship, which I found the most challenging, to be honest, is to implement what I've learned from the NAM experience back to something in Hong Kong and bring an impact to the society. So with all these kind of exposures, along with what I've been working on in the laboratory, I kind of created a project called Sustainable Brain, Healthy Brain Initiative for disease prevention. And I've been trying to focus on neglected communities in brain health and dementia prevention education. As I kind of mentioned, whenever people thought about dementia, we always thought about aged people who are at 65 years old or above. But if we try to think that if this disease could be developmentally rooted, which is indeed the case, and prevention could start well before the advanced age, then we could lead to potentially some new impacts to the society. So in order to, put this into context in Hong Kong, and then try to relate everything all together in coherence and synergy, I've been collaborating with an NGO in Hong Kong, the Hong Kong Federation of Youth Groups. So in that case, I could get to the target audience that I want to engage, that's the young people. And there are indeed the neglected groups in dementia prevention over decades. And one of the approach is to highlight the drug use as a risk of dementia. So this is what we've been collaborating on. We actually also be part of the Hong Kong SAR, the funding that is against the drug use. So we learned that in Hong Kong, people start to first use illicit drugs probably at a teenage, between 16 to 20 years old, which are likely the high school students in Hong Kong. So in collaboration with this NGO, then I started to create an anti-drug STEM education program. So we know that when we talk about anti-drug usage, it's not very useful to tell young kids to, well, this is when you do drugs, this is violate against the law, and they're just not gonna listen to you anyways. So we try to use a different approach, that is not only educate them, of course, but try to include something that's funny, interesting for them. So this anti-drug STEM education program involves components of the lecture, but also hands-on laboratory sections that will allow students to play with something that they've never seen in their high school life. So I brought out some of the easy to do experiments from my lab, and then try to bring all these funny things that could allow the students in the workshop to play with. So I've designed this program and offer training to the volunteers from the NGO, and then the NGO would help the volunteers are not only organizing workshops to directly to the students, but they also have to offer training to the high school teacher to scale the effect as well. So the teenagers, many of them actually respond very well. By far, actually, this was a statistics that I've learned from the NGO early on this year. So 49 workshops were organized to actually more than 1,500 students from 46 local high schools. Results were very positive. Nearly 90% of the students, they found they had improvements in understanding about the harm of illicit drugs to their brains, and that could be permanent. And similarly, more than 80% of the participants, they showed improvements in self-efficacy to refuse drugs. They learned that this could be damaging not only to their brain, but also to their health, and that might create concerns and trouble to their loved ones. So to scale this effect, by far, 9 sections of teacher training workshops were offered to more than 200 teachers from more than 100 high schools. And the teachers also, we thought that they were teachers, they should know about it, but indeed it was not. So more than 90% of them indicate enhanced knowledge of harm of narcotic substances. And similarly, they also indicate improvements in their teaching skills to conduct the same workshop in their respective school settings. So after their training, we actually gave out the teaching materials for the teachers so that they could do the same workshop for multiple times at their home high school. So the recognition of this program was that it was recognized by the Education Bureau as part of the requirement training for continuing professional development for teachers to support a drug-free Hong Kong and healthy school policy. So I believe that was a number that we predicted at the beginning of the year, but I believe many of these sections were already organized over these months. And more of the high school teachers from the various schools could benefit from our program. So this is a conclusion. So how the fellowship experience influenced my work back into CHK in my lab. It actually trained me to look beyond the microscopic world and brought me a vision of the real world. So as a bench scientist or as someone who works on cells, molecular mechanism, we was always being complained about, well, we're not very realistic. We have our own world, and then we're very detached from the real world settings. We don't understand the real world, but well, having this fellowship actually brought me this kind of vision. And relating to my area of research, it makes me to better understand what things matter to people. So even when I work in the disease of Alzheimer's and dementia, if I could never get into contact with the patients, the the caregivers, and well, other people who would see this set of disease from a different perspective, I wouldn't know how they think, and could potentially miss out what actually matters in their lives. On the other hand, of course, with this fellowship, I'm being able to be known in the field and to know the best people in the field of my work. And finally, of course, the bearing this title as a NAM Health Policy Fellow, it opens a lot of doors to me internationally. I have new mentors, even though I'm now a tenured associate professor. I still have new mentors coming into my life. Of course, they are more senior scientists, but I can still learn a lot from them. And of course, new collaborators and friends around the world. And here are some of the snapshots that I've been taken during my fellowship at DZ, and I traveled quite a lot to different places, not only to meet new people, but also to meet my previous supervisor, who was now residing in Pittsburgh, which is very close to DC. So it gives a lot of chance to reconnect with people who influenced my life, and of course to build new connections to new people that could be potentially influence my work in the future. So this is my sharing. Thank you very much for listening.
All right, so I think this is now the time to take any questions from our audience. Anybody has any questions?
So I've seen one. Do we need to submit a full CV for the application? I think so. I believe that if you look into the application form, first of all, you have to fill in all the requested information on the application form. And of course, you can supplement the application with your CV to better allow the interviewers to know about your background and where you're coming from.
Okay, so about the CV, right? So I actually have over here the application form with me. You can actually go to the website and download the application form. I'm gonna show it to you right now, right here, okay? Just give me one moment to share my screen. Let me see. This is it. Can you see my screen? So this is the application website, okay? And you can actually, you scroll down and then you will see all the information. You have the information sheet and the application form. You click over here, all right? And then you will download the application form, which is actually in Word format. So let me just show you very quickly the Word. Okay. All right. Are you seeing my screen here? All right, so this is it, all right? So application form, okay, type and written in English, no handwritten application, please, and then a reference letter, 2 references letter, 1 supporting letter, okay? So here we go. So you'll see that you need to type in all these information. Now, what you need to actually do is to put in these experiences and research work, publication, and academic qualification. You can add, okay? You can add over here. Now, the question is, do you need to have the full CV, meaning every single publication over there? I can honestly tell you that it is not the quantity. I think you should be selecting some of your most representative publications so that, they can be highlighted in the application. All right, so not your full 200 or 300 papers or 100 papers, however many papers you will have, because people will be reading it, but they will not be going through all your papers. This is not a substantiation exercise. This is more about how can you make it so that people can see you as a right candidate for the application for the fellowship. Okay, I hope this answers your question. Okay, the application form is quite simple. How can I highlight my achievements not required to fill in form, just such as awards? You can add. That's fine. Yeah. Do I need to input author list in the publication form? I don't really understand author list. You mean like in the publication? Yes, a citation, a proper citation in a citation format would be great. Yeah. I think that's answered already. Okay. Is that clear? Okay, let me see. Selection criteria. I think this is a very interesting question. So I think the selection criteria is whether we think that you are a good fit, okay? Whether we see that you are, passionate about making changes in the world, in the world of health and health policies, and whether you know what you're doing, really. I mean, why you're actually doing this. We want to see that you are attuned to understanding what health policy is really about, right? And not that you need to know or you have done health policies in your life before, but you understand that this is an opportunity for you to translate your work, your scientific work, into something that may be able to make an impact on the population and that you're passionate about it. I think that is really what we're trying to see from you. You're doing your application. And so there's actually, a place where you will have a 500 words personal statement. That's where you should be demonstrating to us, why you're motivated to do this, what draws you to the fellowship, okay? What do you think is your objective of doing this fellowship, a career or educational goal of doing this fellowship, and your interests. So as I said, if you can identify projects from the NAM website that you're interested in, please tell us, or you have read certain consensus study reports that really, strike a chord with you, tell us. That's where you should tell us. Okay. Kim, do you have any follow-up to that? That complement my answers.
Yeah, so I remember what I did was, like you said, identify some potential studies, even though you might not be able to tell at that point whether or not you will be able to join that study, but at least try to look for something that interests you on the NAM website.
Yeah.
To show that you have some ideas about what you want to do, and that also lets you to hook on to some thoughts about how your own work could link to what's happening at the NAM.
Yeah. And the question is, do we need to do an interview? You will be interviewed, and that would be very important. That's, I think, would be probably, you know, it's a hit or break, right?
Yeah.
So that's very important because we will actually be talk
Yeah.
to you. Yeah.
Yeah.
Any other questions? Oh, I have a question for you, Kim. When
Mm.
you were doing your fellowship, do you spend in total 6 months in Washington, D.C. at the end? Did you do that?
To be frank, I didn't spend well, I would like to say maybe 5.5 months in a
Ah,
total.
that's
And
ah,
I wasn't it wasn't really a straightforward arrangement because I have teaching obligations spanning all over the year. And plus, as I mentioned during my presentation, I do encourage a fellow to join the some of the forums that are tailored to fellows. One is to be held in September, October-ish. The other one to be held in April. So so my so from my perspective, because of my teaching schedule, I could only be spending a substantial amount of time in DC during summer. But if I want to join those forums, then it doesn't make any sense, right? Because I could only be there in summer, but I still want to join those forums. What I told the this what I told the sponsor was or told NAM was can I sort of split my 3 month per year fellowship into two chunks per year. So let's say in my first year there will be part 1A and part 1B of my residency. So part 1A was a short one that allows me to go to one of these forums in April, and then I would spend like 2 weeks in April in DC so that I could come back to Hong Kong and finish my teaching before the semester ends. But that would allow me to at least meet some of the people during the forum. Then afterwards, after all kinds of exams and grading, then during summer I really spend a substantial amount of time to be out there. Like so therefore I wouldn't say that I spend like perfectly 3 months per year, but like 2.6, 2.7-ish months of residency in a total of like two parts combined together per year. So that also works if you have could figure out an agreement with the staffs from the NEM and of course from your home department because well, teaching is a kind of mandatory and it's an obligation for me in the School of Life Sciences. So by for that arrangement, everybody will be happy. It just happens that I need to travel more times. That might be a little bit tiring, but that's okay.
mhm. So you basically try to avoid your the time when you have to teach, right? To go to
Yes,
DC.
yes,
Okay, okay. But I think the participation in those forums and the actual room where the actions are taking place is actually very important. I mean, to answer one of the questions, in the Q&A, whether collaboration with, online collaboration with NAM is acceptable. I think it is, in some sense, because, there are things that you may not need to do right there, right? But then there are things that you want to actually go over there because you will be having a first-hand experience of how did they actually do it, right? So I think that is quite a transformative experience that I don't think you want to miss. But
yes,
then there are other things that you can do online. And I did that too, right? Because of COVID, we actually were all forced to do it online. But now the consensus study, I don't think they're actually doing a lot of these online meetings anymore. But during COVID, they kind of push everything to the online platform. So we were all sitting together in the same Zoom room to figure out the recommendations. So that was a little bit different because of COVID, but I think that's a good question. Yeah.
I also want to add some comments. Of course, online collaboration is will be available at some point, but I do highly recommend if you have this chance to do a residency in person at where NAM is located, then why not, right? And secondly, even though some of the consensus study meetings they are not trivial and they are very long. So I just tell from my experience, the consensus study meeting they will be held like regularly, maybe every 2 to 3 months. So in other words, there will be certainly some part of the meetings that I will not be able to do in person in DC. But participation is required, and I could tell you that those meetings they last for 2 days, which means that during those meetings when I was in Hong Kong and I have to attend those meetings, that starts at 9 and ended the other day at 6. And then the other day, I need to teach without going home. And then afterwards, I could briefly shower. And then when their day starts again, the second day is another marathon-like meeting from 6 to 9 again. So it's very intense that if you're doing everything online, you will not have any rest in Hong Kong at all. And you'll probably miss a lot of things because you will be tired and it's your midnight and usually it's held like in 2 consecutive days and that doesn't make any sense at all. So I've been to these meetings in person and online. I highly recommend you to do that in person because with that if you and other people are in the same time zone, you will be more engaging and have a chance to express your viewpoints and be really contributing to those consensus studies.
Yeah, thank you very much. I'm just typing out some of the answers to some of these questions. I'm going to answer them in one go, okay? And then you can talk about the visa. So there is a question about, whether we need to reach out to the host to confirm topic before the submission of the application. The answer is no, because first of all, you may change your mind afterwards. So this is only a proposal. We want to see what you're proposing and how is that going to match your research interests? How is that going to help you develop your career later on? Number two is you don't really know whether that consensus study is available for you to join. So you actually need to work out with the NAM after you're selected, not really before you're selected. And then will the successful applicants automatically become an NAM fellow? Yes, you are going to be an NAM fellow or NAM-CUHK fellow when you're selected, but this is actually not the same concept as the NAM membership, which is a very prestigious, they usually confer an NAM membership to people who have been working in the field for like 40 or 50 years, okay? So those are people who are, the big names, okay? So you're a research fellow of the NAM or a health policy fellow of the NAM. And for the consensus study, do I need to start a new one? No, because it is impossible for you to start a consensus study. A consensus study is a lot larger in magnitude than our own research study. So it is not one of those PI-led research study concept. A consensus study is actually a lot bigger because you will need to do, if you're involved in a consensus study, it depends on where you're coming in terms of the timeline of the consensus study. If you come in very early on at the beginning, you may be able to contribute by selecting or proposing people that should be in the study committee, right? Then when you have a study committee, which consists of maybe like 20 people, okay? And these are the people who will be sit in these rooms to really, talk about and discuss about these policy directions based on, you know, the question, the policy question that are posted by the funder, right? The funder who commissioned the study, who commissioned NAM to actually do the study. So NAM is actually being commissioned to conduct these consensus studies, okay? And you will be participating as part of that. I hope that is clearer. Is consensus study the only acceptable project form for this fellowship? Now, I would say that if you're going to NAM and if you don't want to participate in consensus study, I think that would be a waste of opportunity, okay? Of course, there's also other formats that you can try to do. I mean, you know, during the time you're there, you can actually conduct a research. That's fine. That is okay, right? And it could be part of the consensus study also. I think that is something that is up to you to communicate with the NAM Fellowship Office, okay? Because you know, when you're actually there, you would realize that NAM is so huge. It's, you know, you know, it's kind of like almost like, you know, on a university scale, right? So there are many different divisions within NAM, okay? So it's very big, okay? So what you need to do, okay, just so that you can really gain the most from the experience is really, I think it is very good for you to attach yourself to a consensus study because you can learn from there. Of course, you can initiate, which I have also done that, research that is related, okay, to your fellowship, because at the end, you will actually need to do a presentation, okay, about your fellowship experience. Part of it could be, you know, a research project that you have done that is related to the overarching theme for your fellowship. I would say that. Yeah. Maybe Kim, do you have other
So simply put that, so I saw someone asking, do we need to submit a final report for the fellowship? I wouldn't say there's a report. I don't like the term report, but let's talk about deliverables. It could be, well, having a report. So a report that works, that is a collaborative work with your mentor. That could be a review article. That could be like, if you have you could initiate a project with your mentor, that's fine. So part of the deliverable has to be something to be done with your mentor. The other one could be like, as what we've done, taking part in one or two consensus study and be part of the consensus study report. And then the third one is the contextualization of what you've learned from the NAM. It could be contents related to the work piece that you were doing with your mentor, and as well as those from the consensus study to bring those ideas back to Hong Kong and make an impact in here. And all these are components of deliverables, and that will lead to a final presentation to show to the donor and to other people or the audience what you've been done over these past 2 years. So I wouldn't say a report, something like a written report, but I would rather categorize things into different forms of deliverables. So the other question is, do we need to apply for a J1 visa? J1 is mainly for like a postdoc fellow or employee, temporary employee. You're not an employee at the National Academy of Medicine, but you're just trying to be like so it's like just a fellow or like a exchange scholar. You won't be needing a J1, but I probably a business B1, B2 visa would work perfectly, because J1 hinted would be hinted at the immigration officers that you're earning an income from the United States, which is not the case. So that's not J1 or not the F. You're not a student either. So a business B1, B2 will work for you.
I would add something to Kim's answer to the final report. So we're not requiring people to submit a very formal, 30 pages final report. No. Okay, so that is not part of the fellowship. But we would ask you questions, okay, that you can submit in written form, okay, and we can treat that as a final report. What you have gained from the experience, what you have done, and how do you think you can contribute back to the CUHK and the CU medicine community, right? So that would be something important to have a sustainability of the impact of the fellowship, and how do we bring this back to this to our CUHK community. I think that's very important. Okay. Have we answered all the questions? All right, so last but not least, if you have no other questions, we're here to translate science into action. This fellowship is about that. And this is really your opportunity to make an impact in terms of international health policy. Now, thank you very much for being here. I know, please submit. We would really want to see you submitting and and take this next step to to translate your scientific research interest into actionable impact. All right. Thank you very much. Thank you, Kim.
Thank you.
All right. Have a good day, everybody.